Yeah, so today Alzheimer's Research UK are launching a new brain health checklist. So this really is about what people can do to reduce their risk of developing dementia in later life. And we know that brain health is something that maybe is unfamiliar to a lot of people. So we're used to looking after our heart health, and other elements of our health or our bodies, but actually looking after our brain is hugely important in being able to reduce our risk of dementia. So a lot of the things are maybe sort of common sense. So having a good diet, taking exercise, not smoking, cutting back on our alcohol intake, but also keeping our blood pressure low. So a lot of the things that may be good for your heart are actually very good for your brain as well. This also includes keeping your brain active. So actually keeping our brain active could be through work, through education, through doing crosswords, puzzles, challenging ourselves. All of these things are good for our overall brain health. And so we're launching today a checklist to help the public see what some of those things are that they can do to look after their brains.
So is this for people of all ages? Is everybody encouraged to sort of give this a go, whether you're already, you're quite young and still in education, or just right the way through?
Absolutely. It's for everyone and anyone. And this really is about protecting our brain health. And I think that anyone of any age wants to ensure that our brains are as healthy as they can be. And these are things that you can do throughout life. And in fact, the more you can do that throughout the entire life course, so starting as early as possible, the better the outcomes could be in terms of reducing your risk of dementia in later life.
I noticed one of the things on the list was looking after your mental well-being. You mentioned it there. That I think a lot of people might want to do that, but not necessarily know where to start, because it can be quite ambiguous if you don't know, if you're not already actively trying to look after your mental well-being, you might not really know what that means. So how would you suggest people, start to really take care of themselves?
Well, I think when we talk about well-being, it can mean a lot of things to a lot of people. But when we're talking about brain health, actually, some of those things are just to do with social relationships and being connected. So that's actually in our communities. So getting out of the house, having conversations with people, being engaged, and that might be through the media, that might be through being engaged in films and TV and things that you like listening to or doing at home. But actually it's about also having those social interactions. So that might be through clubs or activities or sport. And we know again that sport is something that's actually hugely important in reducing your risk to being able to keep active. So that might be through walking groups or things like park run that Alzheimer's Research UK have always supported, but actually getting out there and getting some fresh air and getting some exercise, I think, is one thing that's really important for well-being across the piece. But actually it's not just about sport, it's actually those social interactions are hugely important.
Staying involved with people and, like I say, socializing as well as looking after yourself physically.
Absolutely. And I think well-being is also about, a lot of things that can help in reducing your risk of dementia, like eating well and cutting back on smoking and cutting back on alcohol. All of those things often can help our overall well-being and actually can make us feel better when we're looking after our whole bodies. And I think one of the messages that we're saying from Alzheimer's Research UK is actually, if you do all of those things, you can help reduce your risk of dementia, as well as feeling better now. Actually, in the future, that has a payoff too.
Yeah, like I say, they're all things that look like generally keep you in check. You look after yourselves. You're saying naturally it helps your heart while also looking after, your brain. How substantial is the link with reducing the effects of different dementias? What's the research showing in that?
So the research is showing us at the moment that maybe up to 40% of cases of dementia could be prevented through some lifestyle changes. So what we're trying to do at Alzheimer's Research UK are find treatments for people with diseases that cause dementia. So Alzheimer's disease is a disease that causes dementia. You can also have vascular dementia, dementia with Lewy bodies. There are a number of diseases that cause dementia, and there are going to be lots of different ways of being able to treat or prevent those diseases. But like with a lot of diseases, the best way that we can ultimately stop or treat them is actually to stop them taking grip to start with. And actually, particularly for vascular dementia, we know that some of these lifestyle changes in midlife can have a massive impact on reducing your risk in later life. So actually, we've got about 1 million people in the UK living with dementia. So if you could peel that back by even 10%, 20% of people by making lifestyle changes, a little bit like we've done with cardiovascular health. The number of people having heart attacks and poor cardiovascular health has dropped because of actually a number of the interventions and people knowing what's maybe good for their heart and trying to lose a bit of weight or take a bit more exercise, or those sorts of things. And those messages in the last 20, 30 years have helped hugely. And I think that's what we want to see when it comes to brain health. But I think we often don't think of our brain as something that we can maybe change or affect or treat or prevent some of those diseases. Whereas actually we now have evidence building that there are substantial things that we can do. And some of those things are probably relatively small changes in lifestyle that can have a big impact later on in life.
Like you say, going to have a big impact. It sounds like to keep yourself generally more well, but also with links to Alzheimer's and dementia. Do you think this needs to be on the NHS health check? Would you want to see that coming in soon?
Absolutely. And I think that the health check that people have initially at around 40, they should be mentioning dementia in those health checks. So actually, if your GP is sitting down with you and you're having those health checks and those conversations, if they're not mentioning some of these things, that would be one of the good questions to ask. But certainly, I think it's something across the NHS that the more we can do to prevent some of these diseases taking hold, the better. So, on a lot of what we're saying is, what's good for the heart's good for the head. So actually, if you can do all of these things, you're going to help everyone live a healthier, happier later life.
Yeah, I think it makes sense. They're always going to be linked. If you're looking after yourself in one way, you're probably in turn looking after yourself in another way. But it sounds great. Is there anything else you want to add about the checklist or just in general?
So the best way that you can find out more information is to go to Alzheimer's Research UK's website, and there's a brain health checklist on there. You can also look at our Think Brain Health campaign. So there's lots of tools and information that the public can access that will support them in improving their brain health and looking after their brain.